regions for that weather report. We're now moving on to our health segment. Today's topic is fears and their impact on our health. We have a field reporter, Serena, at the University of South Florida, with a physiologist that is involved in this research. Hi Serena, how are you?
Hi Laura, I'm great. How are you?
Hi, I'm well. What can you tell us about this research?
Well, it is a beautiful day here at the University of South Florida. We are on campus today to learn more about some very interesting research concerning fears and how our body responds to them. I will be interviewing a South Florida physiologist, Dr. Barbara Durden, to learn more about her interesting research. Let's go meet her. Hi, Dr. Durden.
Hi, how are you? Good.
Thank you for having us and for taking the time to meet with us. So, how are you today?
I'm good. How about you?
I'm great. So first, can you give us a brief overview of what your research is about?
Of course. So basically what my research is about is looking at how humans react to stimuli, but most importantly, fear-inducing stimuli. And that relates back to the autonomic nervous system, which is our body's nervous system, which monitors how our organs are doing and gives feedback to our brain and lets it know, okay, things are going well or things are not going so well. And basically what that means, it's the nervous system that controls the things that you don't really have to think about, like your breathing, your heart rate, your digestion. Like those are things you don't have to think about. And so this goes back to two divisions of the autonomic nervous system, which are the parasympathetic and the sympathetic nervous systems.
That's very interesting. So can you help explain to our viewers what these systems are and what exactly they help in impacting our bodies?
So if you look at this, like it shows the two divisions, the parasympathetic and the sympathetic, and it shows how while they work on the same organs, they have opposite effects on these organs. So the sympathetic nervous system has to do with your fight or flight response, which means when you counter something that may be dangerous to you, your body prepares to either fight or run away. And this is caused by increased levels of epinephrine, which affect your heart and causes your heart rate to increase, your breathing to increase, and like to just prepare for this possible danger. And the opposite of this is your parasympathetic nervous system, which has to do with the hormone neurotransmitter acetylcholine, which has to, and this is involved in the rest and digest, which basically is the opposite of the sympathetic and brings you back to where you were before you encountered this danger that increased your levels of epinephrine.
Wow, that's really amazing how our bodies are so coordinated to, react in these situations. So, Dr. Durden, how does this all relate to your research, and how are you conducting your research to find the results that you want?
So how we're conducting our research is we're screening volunteers that come in for fears, conditions, anything that may affect like how they respond to things. And then once we screen them and they pass all our tests, they come in and we start doing testing with the fears that they state to us. Like they may have a fear of spiders or of elevators. So we, in a controlled environment, we present this stimuli to them and record their responses through heart rate, blood pressure, doing a blood test to see how their levels of epinephrine rise as they encounter this stimulus, and then how once it's removed, how they come back to where they were beforehand.
So is it just students that come in for research opportunities, and is it voluntary?
Yes, it's voluntary, and we have people come over from all over. Students, they get credit for some classes. People come in from the outside just because they want to be a part of research, and so it gives a good mix and the population size to the actual study.
Sounds like an excellent experience for college students. So I have a question for you. So how do these prolonged fears or stressors affect or impact your body?
So whenever your body's in this fight or flight response, your levels of cortisol and epinephrine increase, and this causes, of course, the natural, like as I mentioned before, these responses like heart rate increase. But then prolonged levels of these cortisol hormones can lead to conditions such as anxiety, diabetes, weight gain. There's so many different things that it's connected to, and this in the old times it was good to have this response because you never know when a predator may come after you. But now in today's world, this sympathetic response can be brought on by anything ranging from traffic, bad day at school, at work, somebody cut you off. Like, it can be brought on by so many different things, and as these keep happening and this increased cortisol level, it just does a lot of damage and can lead to some serious conditions.
That is very interesting. Thank you for having us, Dr. Durden. And back to you, Laura.
Thank you, Serena, for that great coverage. Next up, I will be interviewing the Professor of the Year award winner, Dr. Benjamin Prepmore. Stay tuned. On to our health. We're now moving on to our health segment, where today's topics are fears and their impacts on our health. We have our field reporter Serena at the University of South Florida with a physiologist. I think I should speak slower.
Yeah, that would probably help.
Because
Well, it is a beautiful day here at the University of South. Oh my god.
Go.
Okay.
Go.
Thank you, Serena, for that great coverage. Next up,